It's 2019, which means we all want to look and feel our best. But did you know that if you focus your efforts purely on weight loss, you can actually find yourself in cycles of regaining weight, low self-esteem, and a preoccupation with food and body image? But don't worry, Dr. Tamyra Rogers of Dr. Rogers Centers is here to talk to us about a new healthy alternative and a New Year resolution. Good morning, Doctor.
Good morning.
Welcome.
Good morning.
Happy New Year.
Thank you. Thank you.
So share with us. Let's get right to it. We want to know the secret recipe for this weight loss.
I feel like the secret recipe, number one, is setting a realistic goal. So we always try to set a goal that's going to be a BMI that's going to be healthy, right? To try to get rid of disease or prevent disease.
That's true.
The other is when patients come in, you really want to do something that you like eating.
Yeah.
So a lot of people will go on a diet that's not even foods they like. Maybe you're a vegetarian, so why are you going to go on the high?
You're setting yourself up for failure right
there. You are,
yeah.
because now and then how are you going to maintain? Because then you're going to have to change your whole diet for maintenance.
Right.
The other thing is that a lot of, when you exercise, if you're a good exerciser, make sure you're in that right VO2 zone, that you're actually burning fat.
What is that VO2 zone?
So VO2 means that what kind of shape you're in. And so at our center, we test so that to be a complement to your weight loss program, you want to make sure you're in that fat burning zone for most of your workout, so that you're not really wasting your time in the gym, you know, and creating a situation where you're just making yourself more and more hungry when you're trying to lose weight.
Yeah, so set realistic goals and make sure that you, especially when you work out as well, it goes, you know, it all falls into place. But also, Dr. Rogers, in San Antonio, especially in South Texas, people suffer from diabetes. And so we gave a little teaser here saying that the medication could actually be hindering you from reaching those weight loss goals. What alternative do you have and programs do you offer?
Yeah, so if we think about a lot of medications have side effects. So the best medication I always tell people is basically you want to make sure that your food is your best medicine in some regards, and exercise are your best medication. Because if we look at all the medications, they can cause skin reaction, they cause nausea, and even some medications that treat diabetes actually raise the insulin level and cause the whole problem of diabetes in the first place. So you're actually taking a medicine that's making you gain weight, and then, which is making your diabetes worse, even though your blood sugar levels are coming down. So you're kind of battling against yourself as you're doing that.
So what's the point of even taking the medications in the first place?
Well,
then?
I mean, you do need the medications, because with some diabetics, they have to have insulin if you're a type 1. But if you're a type 2, the best especially is to make sure that you're eating properly and utilizing, you know, and really working on those goals with the exercise and with the medications that can help you lose the weight.
Right. Okay. So we want to know, what is the Dr. Rogers difference? What programs do you offer that can cause, you know, help us with those alternatives?
Well, I feel like the programs that we offer are set up for you. So you give us an explanation of what your lifestyle is like. And then we're going to create a program around what you already do, what foods you enjoy, what foods you may be allergic to. And then we also look at what type of physical limitations you may have. And a lot of people are like, well, I can't really start losing weight till I get my knee fixed. Let's start losing weight before you get your knee fixed, and let's rehab and see if we even need to fix the knee after that point, right? So I think that's going to be the real key as we move forward, is that we want to design a program that's going to work for you, but then at the same time, make sure that you're reaching your goals that you want to get to in the amount of time you want to get to, and we can realistically help set that up for you.
Yeah, that way you're not bouncing back to your old lifestyle and then you're just waiting until it's January to be able to
Exactly. I mean, transitioning, I think a lot of times as people start losing the weight, they start getting worried as they get close to their goal, and we have what's called a transition program. Because at the beginning, I'm not sure where you're going to maintain, but at the end, when we go to transition, we can look at how many calories you burn per day, where are those calories coming from, and where should you exercise at, so you have a roadmap for maintenance. That is the whole key, is getting to that transition program and then getting to that maintenance part.
That maintenance. And, you know, we want to show you guys a before and after image so you have an idea of what Dr. Rogers can do for you. Tell us about this patient, Dr.
So this patient, actually, this is, you know, we have a lot of tools at Dr. Rogers Center. So one is the Obalon, which is the balloon that we've talked about before. So she lost over 50 pounds with us, basically using the Obalon technique with that restriction of food.
She looks fantastic.
She looks great. She looks great. So she's going to go into the new year. It's going to be easier for her to exercise and to just keep that weight off.
Yeah. So guys, make sure you guys mention that you watch this segment today. That way you can receive a complimentary consultation and up to $5 discount on the Obalon program that Dr. Rogers was mentioning, a $500 discount. So the number is 210-871-0077. Dr. Rogers has 2 locations, 1604 and Redland Road. You can call 210-871-0077. 888-978-0077. You can also visit online at drrogerscenters.com. As always, thank you so much, Doctor, for being with us. Appreciate you. All right, and keep it on Ken's 5 to find out which celebrity got dissed by another celebrity. That's after the break. We'll be right back.